Okay, so um, my name is Tanya. I'm one of the counselors for the Faculty and Staff Assistance Program. Right now, there's two counselors, two Tanyas. We're hoping to get a third person. Just, to share a little bit about what we do, for those of you who may not know, we are a service that is available to all full-time and part-time employees of the university, as well as dependents. And we help employees address a number of topics, whether they're work-related or personal issues, because our mission is to support, enhance, and expand the work of the university's faculty and staff by providing a high quality of mental health and support services. And one of the ways we hope to do that is by these lunch and learns, workshops, and trainings. We also offer assessment, referrals, and short-term counseling, which is up to 10 sessions, again, for mental health, substance use, a number of things. The sessions are free and confidential. Confidentiality does have limitations really around safety. So if you're having thoughts about harming yourself, if you're having thoughts about harming someone else, if you report any child abuse or elder abuse or abuse of somebody that's disabled, Maryland law requires us to report it. In addition to therapy and presentations, we also offer debriefings following traumatic events and fitness for duty evaluations. Today, we're going to be talking about when seasons change, so can your mood. We're going to be talking about seasonal affective disorder, what it is, how to prevent it, and how to cope with it. This is just a brief agenda. We're going to just define what it is, talk about what it looks like, and again, how to prepare and prevent it. Does anybody know what seasonal affective disorder is? Anyone have a guess? Well, seasonal affective disorder is a type of depression that's triggered by a change in season. Typically, it starts usually in the fall, and then it gets progressively worse as it gets colder. There is actually a milder form of seasonal affective disorder, which impacts people in the summer. And so it starts in the late spring and summer months and ends when it starts to get cooler. And there's a milder form of seasonal affective disorder where people start to feel down or have less energy, and it's often referred to as the winter blues. Like somebody wrote in the chat. Yes, exactly. Thank you, Nicole. So here are some symptoms of fall/winter seasonal affective disorder. A lot of the symptoms overlap with general depression, which is sadness, feeling depressed most of your day, almost every day, some symptoms of anxiety, cravings of carbohydrates. Some people experience weight gain, extreme fatigue, lack of energy, feelings of hopelessness or worthlessness, difficulty concentrating, can cause you to feel irritable. It can cause your legs and arms to feel heavy. Oftentimes, there's a loss of interest in things that are typically enjoyable. People tend to isolate, have sleeping problems, and sometimes there's thoughts of death or suicide. Some symptoms of summer seasonal affective disorder are anxiety, insomnia, restlessness, lack of appetite, headaches or migraines, again, some irritability and lack of motivation to go out or do anything. So there's not an exact concrete cause for seasonal depression. Um, Researchers continue to study what factors contribute to it, but here are some of the theories. One is that when there's less sunlight, our internal clock that regulates mood, sleep, and hormones kind of shift because the schedule changes because there's a change in daylight length. It gets pretty dark here starting at 4, 4:30. If you're used to longer days, that can change your internal clock. Um, if you're at risk for seasonal affective disorder, some people may already have less serotonin activity. Serotonin is a chemical that contributes to feelings of happiness. And since sunlight can help that, if there's less sunlight, it can cause people to feel less happy and lead to depression. Serotonin can also be increased from vitamin D. We get vitamin D from sunlight. So if there's less sunlight, it can also impact our serotonin level. Melatonin is a chemical that affects our sleep patterns and our mood. And again, lack of sunlight may stimulate an overproduction of melatonin in some people, which can cause us to feel a little bit more sluggish or sleepy. And people with SAD often have stress, anxiety, and negative thoughts about winter. So researchers aren't sure if these negative thoughts are a cause or effect of seasonal depression. Did somebody have a question? So just some statistics about SAD. About 5% of adults in the US experience it. About 10% to 20% of people may experience winter blues, which is the milder form. And about 4 out of 5 of the people who are experiencing it in the colder months are people who are assigned female at birth. So here are some ways to treat seasonal affective disorder or winter blues. If you think it can be depression, it's important to see a mental health professional. If you see a mental health professional, therapy can be really helpful. Cognitive behavioral therapy can help change distorted views, negative self-talk, um, things that may be impacting your environment. And it can also help you improve interpersonal relationship skills, which can help manage your stress. There's also what's called light therapy. There's a special light that mimics sunlight. So if you're not able to, sit in the sun or, walk during the day to expose yourself to more sunlight, there's a light box that you can, purchase on Amazon. And, experiencing some of that light throughout the day can be helpful. Um, there's also, it's also important to talk to your doctor about that so you can know how long to sit in front of the light therapy. Sometimes antidepressants can be helpful in correcting the chemical imbalance that can cause SAD. And then taking vitamin D supplements can be helpful as well, but it's important to talk to your medical provider before doing so. And how to prevent and relieve symptoms. If you're somebody who thinks you may experience winter blues or seasonal affective disorder, it's really important to set realistic goals. Don't take on too much. Break large tasks into small ones. Be really clear about what your priorities are and do what you can as you can. If you know that during the winter months things are harder for you, this is not the time to take on a bunch of extra projects because if you're unable to complete them, that's also going to impact your mood. It can be also helpful to be around people you care about and talk to them about how you're feeling. Stay away from people who make you feel drained or make you feel bad. Do things that you enjoy. Go to a movie, take part in any religious, social, or activities in general. Doing something nice for someone can also be helpful. We last month we did a lunch and learn about giving back in mental health and how that can increase mood. Making sure to continue to get regular exercise, and also being realistic about how long it might take you to feel better. If your mood isn't being impacted by the change in season and by the change in daylight, it may take a little bit to start feeling better. It may take the days starting to get longer, but just a reminder that it's not going to be a switch and you're not going to just wake up and feel better out of nowhere, that it might take time. Eating healthy, well-balanced meals, staying away from alcohol or drugs. This can impact depression and make it worse. Delaying big decisions until the depression has lifted. This is really important because with anxiety and depression, oftentimes we have a lot of distorted thoughts. So if our thoughts are distorted, that can really impact our decisions. So before deciding to make any significant transition, like change a job, ending or starting a relationship, talk to other people, talk it through, talk to your therapist, make a lot of time to reflect before making the decision. Remember that people really snap out of it. Again, it can take a little while and people can start to feel a little bit better day by day, but it's not you're depressed one day and then you're fine the next day. Try to be patient and compassionate with yourself. Focus on the positives. This can help replace the negative thinking. Again, as I mentioned, with the distorted thinking can be negative thinking about yourself or just about the world. And negative thoughts will start to lessen as your depression starts to improve. Practicing gratitude can also be helpful for your mood. Allowing people to help you. If you know that the winter months are difficult, it's okay to accept help during those times. It's always okay to accept help, but especially when you're having a difficult time. And again, exposure to sunlight can be really helpful. Spending time outside, sitting near a window can help relieve symptoms. In the summer, I try to eat outside as much as I can. As it starts getting colder, I try to at least sit in front of a window. I don't know if you guys can see behind me, but I do have a window and it gets a good amount of sun. So I eat lunch in front of the window sometimes as a way to make sure that I'm getting enough sunlight. Check in with yourself daily. These are some questions that you can ask yourself. Have I eaten today? Sometimes it's 2 o'clock, you look up and you haven't had anything to eat all day. You haven't had any water. How is my energy today? How is my mood? What would help me feel better right now? Is it calling a friend? Is it watching a movie? Is it journaling? Is it going on a walk? And then remember to practice self-compassion. Being hard on yourself because you're feeling sad or because you're feeling depressed is not going to help the situation. Here are some on-campus resources. RecWell is a way to continue to be physically active. The University Health Center has a ton of options that are also available to faculty and staff, such as massage and acupuncture. The University Health Center also has a meditation program where they offer virtual and in-person meditation. And I'm just sharing Psychology Today as a resource to finding a therapist. But again, at the Faculty and Staff Assistance Program, we can also help connect you to a therapist if needed. Does anyone have any questions? I'm going to stop sharing my screen. Any questions about any of that? You all heard of seasonal affective disorder?
Hey, this is Nicole. I was going to unmute and ask my question if that's okay, rather than typing it.
Sure.
So I'm really familiar with seasonal affective disorder, and I have a close friend who suffers from it pretty dramatically. And so it's part of why I attended this session, just because I'm always trying to find ways to help her. And this being the beginning of the darker days, it's pretty dramatic right now, which is also complicated by the holidays.
Yep.
Um, Do you have any suggestions for those of us who may have a friend or a loved one who suffers from this and how we can be helpful without kind of also getting ourselves sucked into the the depression?
Yeah, that's a great question. Thank you. Um, I think the first step would be asking them what they think would be helpful. Sometimes people don't know how to answer that, which is okay, but sometimes people do know what's helpful for them. If they don't, I would think about the things that you know about your friend. What do they enjoy doing? What are things that they do to typically help them feel better when maybe they're not as depressed? And again, to practice compassion, to try to be patient. I would check in with your friend. If you know your friend is not the kind of person that would ask for help, that might mean checking in a little bit more often. But just, doing things to help lift their spirits. Um, in addition to it being cold and dark, like that also impacts people's energy or motivation to do things. People typically just want to stay inside, and that's okay, but maybe it's a movie night, maybe it's a game night, or maybe it's getting in a car and driving around a neighborhood to take a look at all of the lights and the decorations, but finding creative ways to still be social and do things that your friend enjoys, even though the automatic response to short days and cold days might be to stay in. And, you know, making those decisions based off of what you already know about her. In terms of not being sucked into the depression, which is also important, boundaries and checking in with yourself. How much energy do I have to support my friend right now? Do I have the energy to listen to her vent for an hour today? I don't. But maybe I have energy to invite her over and sit on the couch and watch a movie. Or maybe I have energy to, grab a tea with her. But checking in with yourself before you offer help to see how much capacity you have, how much energy you have before offering help, because that can also impact how you show up or how you feel after being with your friend.
Great. Thank you so much for those suggestions. I have found taking things to her is better because this time of year she's just moaning and groaning that she doesn't want to go outside. So carry out over at her house is usually a really good solution.
Mhm.
My only other question is you mentioned something about the light
Yeah.
or light box that you can purchase.
Yeah.
I know one of the things she does regularly that I always try to discourage is she goes to use a tanning bed, which I know is supposed to help with the sort of imitation sun rays, but it's also really bad for your skin. So what is the other like the light that you were talking about?
Yeah, the light box, and I can share a link after. Um it's not as strong as a tanning bed. It's not gonna like tan you. And there's only like a specific amount of time that you're supposed to sit in it. You're not supposed to be in front of it all day. Um I believe your medical provider or a therapist can suggest, sit in front of a light box for 5 minutes a day. There's a specific like strength. I can't remember what the unit is, but that you can put the light box on, but it's it's something that you can do, but it also needs to be monitored, and it's easier to make sure that you're doing it in the right way and in a safe way by talking to your medical provider. But a lot of like your primary care provider, her primary care provider um may be pretty um knowledgeable about what can be helpful for her. And let me just actually stop.